I'm Kate Conway, I'm the matron for Antenatal and Gynaecology Services at the Royal Surrey. I'm talking to you today to introduce our digital induction of labour toolkit. We've created this toolkit with our Maternity Voices partnership and feedback from our service users to give you immediate access to information around induction of labour that will support your decision-making process and give you all the information you need about the experience of induction of labour that you're about to go through. We know that women sometimes do not feel that they have a choice when they are offered induction of labour. You do have a choice. Every baby, every woman, every pregnant person is different, and what worked for you last time or what happened in your last pregnancy may not be right for you this time. What happened to your friends, what happened to your family is all different. We want you to be able to feel that you are making an informed choice about your care. At no point does this toolkit replace the advice and the information that will be given to you by your midwife or obstetrician when they offer you induction of labour. But we do want you to be able to feel that you can go away and look at additional information and further reading to be able to make that decision yourself and feel comfortable with the decision that you're making for yourself and your baby. In the following films, we are going to give you the tools to make decisions. We're going to teach you about the BRAINS acronym, a decision-making tool that you can use by yourself or with your healthcare provider to make a decision about induction of labour for you, about the procedures that you will go through and you will be offered as part of your induction of labour. We will take you through the process of cervical softening and how we break your waters. We will talk to you about how we stimulate your contractions. We're going to talk to you about how we can support you, how you can support yourself, how your partner can support you. We're going to talk about the pain relief options that are available. We're going to talk about how long the process can take and where you will be. As well as the videos within the toolkit, there are relaxing audios created by midwife Natalie, our cognitive hypnotherapist, to help you relax during your induction of labour, but also before you come in for your induction and also for use when you're at home with your baby. We have a birth preferences template within the toolkit. When you're offered induction of labour, sometimes that can change how your birth that you were thinking about for 9 months is going to proceed. So take some time to look at the template, write down how you would like things to happen when you're in the ward for your induction, for if you proceeded to a caesarean birth, for what you want to do to help you when you're on the ward and when you're on delivery suite. There's also self-help tips for you and self-help tips for your partner to support you when you're going through induction of labour. We provide you with links to further reading. These are best practice and the best evidence that we can give you from unbiased sources that you can read at your leisure, in your own time, again to help your decision making about how you want your induction of labour to proceed. It's really important to remember that induction of labour is an offer. You may be offered induction of labour for a variety of reasons, and the risks and the benefits should be discussed with you by the obstetrician or the midwife who is offering you induction. For some women, induction of labour is exactly what they want, and they are very happy to make that decision on the day and say, yes, that's what I want. But not everybody does. For some of you, you will want to go home and discuss it with your families, or you may not be happy to make the decision to go through induction of labour. That's fine. You're allowed to do that. If you choose not to take up an offer for induction of labour, or you want more time, we will continue with your antenatal care. We'll offer you additional follow-ups, and depending on your individual circumstances, you may be offered consultant appointments, additional scans, or perhaps even fecal monitoring. Once your induction of labour is booked, you're going to be asked to consent to everything at every stage of the process. Every procedure that we do, you will be asked to consent to. If you choose to decline at any point or you need more time, you just say so. Using the BRAINS decision tool that you'll be taught about by midwife Caroline is a really important way for you to be able to clarify your thoughts about what's being offered, about the decisions that you're being asked to make and the procedures that you're about to go through. It will help you to make the best decision for you and feel that you are fully informed about the decision that you are making. We really hope that you find this toolkit useful. If you've got any further questions after you've looked at everything within the toolkit and you've viewed these films, please speak to your community midwife, to your obstetrician, or there are other people available on the wards. There are professional midwifery advocates who are always available to offer additional advice if you want to discuss your decisions further.
When making any informed decision, you might find it helpful to use the BRAINS tool to ensure that you've got a full, rounded, balanced set of information. So BRAINS stands for B for benefits, thinking about the benefits of what's being proposed. They might be the clinical benefits, but also whether there are any personal benefits to you as an individual or as a family. R stands for risks. So what are the risks or the disadvantages of the options that are being proposed to you? And again, thinking about those that are noted clinically from research and also those that are personal to your own experience. A stands for alternatives. Are there any alternative routes or options available? And again, when we're thinking about our alternatives, we also need to consider their individual risks and benefits as well. I is your intuition. What is your gut telling you? Do you have strong feelings about this decision making? Do you feel like you need further information in order to be able to make that decision? N stands for nothing. Consider whether there are any benefits and risks in not going with the proposed suggestion. It might be when you're thinking about nothing, it might be whether you want to think about whether there are any benefits and risks in just delaying that decision making or delaying that suggestion by an hour or day or week. And S stands for second opinion. Do you have enough information to make your decision? Do you want to look at other sources of information, research sources? Do you want a second opinion from another clinician? Come back in the next video where I'll be discussing membrane sweeps and ways that we assess you in labour.